Thank you, Dr. Miller. Ladies and gentlemen, please welcome the newest member of our faculty, Dr. Trista Bailey, who will present the vision of the future of pharmacy practice.
Thank you, Dean Strong, and thank you all for coming to celebrate the future of pharmacy sitting before us. Picture this, 4 different medications inside just one pill. A pill bottle that sends reminders to your cell phone in the form of a text message or phone call to help you remember when to take your medications. Using insulin, a common injectable medication for diabetes, as a nasal spray to treat other disease states, such as dementia. Now, some of you may be thinking these scenarios sound like something out of the classic cartoon The Jetsons, but in fact, these are all advances coming soon to the profession of pharmacy. Right now is one of the most exciting times to be involved in pharmacy. The future of pharmacy is a bright and thrilling one. Our profession is advancing at epic proportions. The Joint Commission of Pharmacy Practitioners, made up of pharmacy leaders all over the nation, created the document Future Vision of Pharmacy Practice by 2015. This document states that the profession is striving towards pharmacists being the healthcare professionals responsible for providing patient care that ensures optimal medication therapy outcomes. Essentially, the pharmacist will be the drug expert. In the community setting, this means that the pharmacist will be more involved in and expand the role of medication therapy management, also known as MTM. Patients can come to the pharmacist with a list of their medications, and a pharmacist will work with the patient's healthcare provider as well as a patient in order to find a drug regimen with minimal side effects and maximum benefit. The hospital setting will see the pharmacist being utilized in more specialty areas, such as emergency medicine and surgery. In the ambulatory care setting, they're expanding the roles of the pharmacist to act as a mid-level provider, like a physician assistant or nurse practitioner. Patients will make an appointment with the clinic, and the visit is run just like a doctor's visit, with the pharmacist being able to adjust and write their own prescriptions under a scope of practice independently from the physician writing the order. Ideas that started off only as a thought or a dream are quickly becoming a reality. Health technology is also another part of the bright future of pharmacy. Through advancements in technology, pharmacists are discovering ways to help patients. Telepharmacy is an exciting opportunity that allows patients in rural areas to be able to see and talk to a clinical pharmacist via teleconferencing software, similar to Skype. Electronic medical records will allow pharmacists working at retail locations to have access to lab values to ensure medications are dosed accurately. Personalized medication, where your DNA is mapped out, is becoming more available and cost-effective. Using your individualized genetic code, healthcare providers can test your genes to see if you'll be more susceptible to certain types of cancer, more likely to bleed with the use of anticoagulants, or even immune to HIV. Technology is changing the face of pharmacy and medication. It would only be a short time before we ask ourselves, isn't there an app for that? As you can see, the future of healthcare is exciting, intriguing, and coming soon. Welcome, class of 2016. You are the future of pharmacy. I will leave you with a quote from one of the biggest dreamers of the 20th century, Mr. Walt Disney. If you can dream it, you can do it. Thank you.
Thank you, Dr. Bailey. Dr. Heather Wild will provide the history of